I believe most of the committee members are here, so we'll go ahead and get started because we have a few presentations today. So I'll go ahead and call the meeting to order for today's statewide substance use response working group, and this is a subcommittee on prevention. Can we please proceed with calling the roll?
All right, Senator Doñate.
Here.
Debbie Nadler.
Here.
Eric Schoen.
Present. Good morning.
Morning. Jessica Johnson. Senator Severs Gansert.
Here.
Mr. Chair, we have a quorum.
Thank you so much, and please mark Ms. Johnson excused. All right, let's go ahead and continue to our next agenda item, which is public comment. At this time, I will ask if there's any folks who would like to provide public comment. Please remember that public comment may be limited to 3 minutes each, and no action may be taken upon a matter raised during a period devoted to comments by the general public. So at this time, Emma, is there anyone who would like to provide public comment?
Oh, yes, it looks like we have a Rhonda Fairchild who raised her hand.
Ms. Fairchild, please proceed.
Good morning, Rhonda Fairchild for the record, and I'm here representing the public. Thank you.
Thank you so much. Is there anyone else that would like to provide public comment at this time?
I do not see it. Anybody?
All right, seeing none, let's go ahead and move on to the next agenda item, which is to review and approve minutes from the September 15, 2022 Prevention Subcommittee meeting. Committee members, are there any questions or concerns or comments about the meeting minutes? Seeing none, I'll go ahead and entertain a motion at this time to approve the minutes from our last committee meeting.
So moved.
Thank you, Eric. We have a motion from Eric, and do we have a second?
A second.
And we have a second from Ms. Nadler. Any questions or comments? Seeing none, all in favor, please say aye or raise your hand.
Aye.
Aye.
Looks like everyone's in favor. Any opposed? Any abstentions? With a motion, unanimous motion, we'll go ahead and approve the minutes from last meeting. We will go ahead and for the next agenda item, let's just make sure that our presenter is here.
I just admitted him from the waiting room, so I think we're good to go.
Sounds good. Okay, so today we have a presentation from the Nevada Board of Pharmacy, who will be providing an update on Narcan. This was something that Dr. Woodard had recommended to the Prevention Subcommittee regarding the development of our policies. So we'll go ahead and Mr. Weist, thank you. Please proceed.
And sorry for my delay. Yeah, thanks to this group for letting me speak today. I just wanted to give a brief update on naloxone, Narcan, as most of the statute calls it, opioid antagonists. So there, it doesn't have to be Narcan. It can be any of the drugs, and there's some newer ones coming out that are different than naloxone that might be more beneficial to patients. So the legislature has made several rules relating to this. They're kept in one of the Board of Pharmacy's chapters. And as a general overview, people get confused about Narcan and who can have it, who can give it out, those kinds of things. So there's really 2 steps where it would go. The first is through a medical practitioner or a pharmacist, where you can go to the pharmacy and get it. You don't need a prescription. They're allowed to charge it for you. Individual practitioner could give it to you. An emergency room could give it to you. And we have that happening throughout the state. The other way is any private citizen obviously can use, I'll just use Narcan for this, can have access to Narcan. Agencies and organizations can distribute it. The rule with that is there must be training with it. And then secondarily, they can't charge for it. So if there's a nonprofit, and you guys work with those people all the time, they could do it. A private citizen could give it to another private citizen as long as they don't charge for it, and there's not a scheme for reimbursing the person for the drug. And so what I think we've seen, and that maybe why I'm here today, is we'd like to get it more widely distributed. I think Nevada's done an excellent job when you compare to other states. There's some states that are not nearly as progressive as Nevada is, We have things like vending machines giving it out. You go to get it at a vending machine down in the south, and you can go, hospitals have it around the hospital where people can take it and use it and those kinds of things. But we could always do more with that. And so I think that would take potentially a statutory change where we might look at this drug more closely to like not a prescription item, that because federally it's still a prescription, so it comes with that stigma. And maybe if we could get a way that Nevada could use it more freely and just be able to purchase it or get it anywhere, that would be something I think that would help with the opioid crisis and overdose deaths. And with that, I'll just pause for any questions that you might have for me.
Thank you, sir. We'll go ahead and allow committee members to ask any questions at this time. Ms. Nadler, please proceed.
Hey there, thank you so much. I have a question, and I don't know if you're related to this or not, but I was told in one of the SURG meetings, I can't remember if it was prevention or the regular SURG meeting, that Narcan was mandated in all our schools. And I actually spoke with Dana Walburn with the Nevada Health State Board of Education. And she told me it's not mandated. It's only in some of the schools. I called Clark County and spoke with the health department there. And she told me she thought it was mandated. So I'm not sure if you have anything to do with that. That's the first question. The second question is it a rule of thumb that doctors, if they prescribe an opiate, that they go ahead and give a prescription, or they go ahead and give Narcan to their patients?
Yeah, I answer both those questions. They're both good. I haven't always attended this meeting as this group is set up, but I did attend your last meeting and saw that question that you posed, and so I did a little preparation for that. So if you look at chapter NRS 653C, where the language is kept, there's clear language that a school can have it, and there's the pathway for them to get it. And when that language passed, I recall that one of the manufacturers donated 2 doses to all the schools in the state if they wanted them, no charge as they were getting up and running. I could not find, and I'm not an expert on that, there may be some ruling over in how schools are run that they must do it, but I can just say, as far as the Good Samaritan law and the opioid antagonist law, that is NRS NRS 453C, it's not mandated in that chapter. So I could probably do a little bit more follow-up for this group if you guys asked me to do that, to check with the schools. Your second question, as it relates, you're gonna have to remind me, sorry. So if you can just.
The doctors, when the doctors are giving out opiates.
So there's not a law requiring it. It is a best practice in certain scenarios, and we're seeing insurance companies cover it. There are some pharmacists that are saying that that would be good, depending on when you're talking with really high doses, that, you know, the therapeutic index can be very narrow in those. It would be a good idea. But if your question, is it mandated? No. Is it done? Yes. Is it a best practice? In some cases it is. In other cases, it wouldn't be necessary. It depends on the doctor, the patient, and then what dose or what drug they're using. Did that answer your question?
It did. Thank you very much. I just wanted to see if it was mandated. Thank you.
Thank you so much. Do we have any other questions from any of the committee members? I don't see any, so I think we will go ahead and conclude this agenda. And thank you so much.
Appreciate
your
it.
presentation. Yeah,
Happy to support this group any way I can, and I appreciate all the work that you're doing.
likewise. Thank you so much. Let's go ahead and close this agenda item and move on to the next one. Finalize subcommittee recommendations. So just as general feedback, last meeting we compiled some of the recommendations and they were sifted through during the SURG meeting that we just had. But Emma can help facilitate the overview of recommendations and suggested changes and edits. So I'll go ahead and turn it over to her.
Great, thank you. So these slides are posted on the SURG website. If it's easy to pull up your own copy on another screen, I apologize, the slides are pretty wordy. But basically what we're trying to do is I have the original recommendation that the subcommittee submitted to the SURG up here in bold, and then I added any suggestions that came in during the October 3rd meeting. So I'll go over that for each recommendation, and we can make changes if needed. And then also I added any justifications or action steps or research links that were included when the recommendation was originally submitted. So just trying to get sign off from the subcommittee on all of that, as that will be included in the final report. So I might actually change the view of my screen so I can edit the slides. If you'll just give me one moment to do that. Okay. Sorry. Okay, so the first recommendation you'll recall was to continue to invest in standing up community health workers, peer recovery specialists, and certified prevention specialists throughout Nevada. On the October 3rd SURG meeting, there was a suggested change on this language on, if we should change it to sustaining or expanding investments. So that's my first question, if we want to change the wording of that. There was also a recommendation from the treatment and recovery subcommittee where there was a potential to merge the recommendations. So their recommendation was to implement changes to recruitment, retention, and compensation of state frontline healthcare workers and enhance compensation in alignment with the Commission on Behavioral Health Board's letter to the governor on June 22nd. So are there any changes, I guess, that the subcommittee would like to make? I know, Eric, during the SURG meeting, you had said that you liked keeping it intentionally broad, so wanted to get the subcommittee's feedback on whether this is the language you want to keep, or if you want to change it and or merge it with this other recommendation.
Thanks, Emma. I'll go first. I do not believe that it's a bright idea to combine with the recruitment, retention, and compensation of state frontline health workers, because we usually conflate public health with healthcare, and those are two different things. The delivery of care is different from the folks who go into the community for prevention. So I think it's good probably to keep it separate. I don't know if Eric has a difference of opinion on that.
I am in support of that as well.
Okay, thank you. And I think it could be, if we do change it, it would, I sustain and expand is instead of one or the other. I think we could do both.
I agree with that. Sustain and expand. I like that.
Thank you so much.
Debbie Nadler, for the record. Yeah.
And that would be pretty much it that I would leave for this recommendation. Unless if anyone else has any other comments.
Chair, I was just going to say great minds must think alike, because both of those recommendations and what Debbie said as well, I was going to say the same thing, but you guys beat me to the punch.
It's a good thing.
Does this wording look okay? Continue to sustain and expand investment in community health workers, peer recovery specialists, and certified prevention specialists throughout Nevada. Okay, I'm just going to.
Yes.
It does to me. Yeah.
Yep.
Great. Let me just put this here so we have a list. Okay, and then this was the justification that was submitted for efficient, effective cost savings, quick to stand up, eager workforce. The action steps identified were expenditure of settlement funds through grant dollars and change of Medicaid reimbursement to allow for reimbursement of community health workers affiliated with behavioral health and SUD agencies, And then we had that research link to the community health worker presentation. Is there anything else that you'd all want to add to that? Okay,
I don't see any comments, so you can continue.
great. So the second recommendation was to support a backbone agency that specializes in data collection, evaluation, analysis, and assessment, and provides consultation to entities across Nevada to help improve internal local data collection systems and create a comprehensive statewide data sharing system that includes all state dashboards and public data. One of the suggestions that came up in the October 3rd meeting was to specify the backbone agency. So that was my first question, is if the subcommittee wanted to specify what that backbone agency would be.
Again, for this comment, I mean, based on the, and feel free, I'll let Debbie speak after me. My personal recommendation is probably not to merge it, because I think those are two different things. For instance, I think we need better collection of social determinants of health that could impact, you know, why overdoses or what mental health statuses or problems are occurring. And that itself would be a part of the data collection of this backbone agency, but that's different from the overdose fatality review, which is looking specifically at overdoses. So that would be my only separation of them, but I could be wrong if there are any other folks. Debbie, did you want to proceed?
No, actually, I agree with you. But I did want to say that I thought, if I'm not mistaken, UNR is doing something with this. The data collection is this the same thing that we're talking about now? I forget the name of the group, but they're doing it through UNR. If anybody knows what I'm talking about, the data collection.
Emma, did you want to respond?
I believe what Debbie is referencing is OD2A. Is that what you're referring to?
I think that sounds familiar. I know it's in Reno, right? The school that's doing it. I believe that's it. I know they were doing data collection.
And if I remember correctly from the last subcommittee meeting, when this came up, it was discussed that that is supported through grants. And so the intention with this would be to set up a long-standing agency. That's my recollection.
Okay. Yeah, no, I mean, I think the wording should be kept. I agree with Senator Donate.
Thank you, Ms. Nadler. Eric?
Yeah, thank you, Chair. I feel like Ms. Ganger was the one who proposed this, and I thought that we weren't ready to make a recommendation on a specific backbone agency because we didn't know if it'd be public or private. We weren't sure where it would reside. So I don't know if we're ready to make that particular recommendation, only that this committee feels like there needs to be some sort of centralized way of collecting this information. Whoever is in position to do that or think about that or make that happen.
Thanks, if I can add to that. Thanks, Eric. Yeah, I don't think we need to call anything specifically out. It's just that we want a centralization of the data. And it was mentioned University of Nevada, Reno may have a piece of it, but basically it's not establishing something new necessarily. It could be coordination, it could be virtual coordination, it could be a lot of different things. But it is the gathering of the information on a comprehensive basis.
Thank you so much, Ms. Senator Gangster.
And Chair, we have Elise Monroy. She is with the OD2A program. I'm not sure if people who aren't on the agenda, if they're allowed to.
Under the discretion of the chair, I will allow it.
Okay, great.
Please proceed.
Thank you. I appreciate the opportunity to make just a quick comment. Just want to let people know that I'm here. Elise Monroy. I'm the program manager of the state's Overdose Data to Action program. OD2A is the state's main source of CDC funding for all fatal and non-fatal overdose surveillance. This is a grant that is received by the Division of Public and Behavioral Health, but I sit with my team at the University of Nevada, Reno School of Public Health to manage the grant. And we are actually working towards and have been working towards creating a centralized data hub and have been doing that for a number of years. We have put together kind of draft investigation plans for doing spike investigations and things like that for the state. So I'm not sure where you guys are in your process, and I apologize for kind of falling off, but we'd be happy to share information about the data work that we have been doing, because we have been working to this end for this recommendation. So just wanted to let you guys know we're here and ready to jump in.
Thank you so much, ma'am. Any other, Eric, did you have a comment?
Yeah, may I ask a quick question of
Sure.
Elise, Ms. Monroy?
Yeah, please proceed.
Hey, Elise, my understanding is that your particular database is specific to opioids. Is that correct?
No, that's not correct.
Okay.
So we collect data on a range of and all types of substance related overdoses. While the committee and the state, or whoever it's going to be, is making recommendations to what the backbone agency is going to look like, I don't know in doing this work that it makes sense to have this be in any sort of private agency. It should sit with the state public and behavioral health, because the state gets money through the CDC to do enhanced toxicology testing. So we're able to contract with the state's coroner medical examiners to do enhanced surveillance on the forensic, on overdose fatalities. We collect data on opioids and stimulant deaths. So in our monthly reports, you will see opioid and stimulant data.
Okay. Thank you very much. I appreciate it.
Thank you. Are there any other comments or questions from any of the committee members? Emma, did you want to say anything? Or?
All right. It seems like I didn't hear any changes to be made to this, so I will go ahead and copy and paste that into the full list. All right. And then again, on this slide, I won't read through all of it, but this was the justification that was submitted, and the action step was on the expenditure of settlement funds to support that. And then there are some links on this slide as well. So I just ask if there's anything that the subcommittee members would want to add as it relates to this recommendation for the justification and action step, and any research or links. Great. So the third recommendation, it was this really long one on prevention in schools, which the subcommittee has talked about being like the heart of the subcommittee. And in the October 3rd meeting, there was a suggestion to break this large recommendation into 3 separate recommendations, so they each stand on their own. So the following slides, I have broken them down into 3 separate recommendations. But first, I just wanted to test to see if the subcommittee was in agreement with that, if you do want to break it up into 3, or if you want to keep it as 1.
Thank you so much, Emma. Unless if anyone opposes, I think that's fine. But that's just Eric.
Yeah, I'm intrigued by the idea. I'd like to see how you've broken it out, Emma.
Okay, great. So this was the first one. So this is on MTSS. So support prevention and intervention in K-12 schools by investing in multi-tiered system of supports, and provide a robust platform of services at schools to connect families to pro-social education, early intervention, counseling services, and other resources to help mitigate adverse childhood experiences. And then we have the justification listed. There was no action step, so that's something that we need the subcommittee to define what that action step would be. And then the following slide has some links associated with it.
Well, thank you so much, Emma. One recommendation that I didn't even realize until we were in the last substance use in the last search committee meeting was that this item says K through 12, but I think we should maybe revise it to be K through 20. I think that's probably something that we left off. That's the only edit that I have to it.
I was gonna say, I agree 100%. Yep. Debbie Nadler speaking.
There you go. Include higher ed. In terms of action stuff, I don't know if any other committee members have an idea of what they would like to say. Eric, do you have any suggestions?
But no, before I'd like to see all three of the recommendations, and then so far I like the way this looks and feels. And can we come back to this and see what the other recommendations look like?
Sure. Emma, please proceed to the next one.
Just going to highlight that so I remember to come back. So then the second one is to provide age-appropriate, innovative, and/or evidence-based prevention education and programming that is based on best practices and invest in certified prevention specialists in schools. And the third is to increase school-based mental health professionals through a multidisciplinary cross-department school-based behavioral health team.
So those are really strong on their own. Whoever made that recommendation at the SURG committee, that really makes those stronger, I think, in my opinion.
Debbie Nadler agrees. Thank you.
Thank you so much. It looks like we'll separate them unless if there's any other disagreement. Hold on. I think you still need the action stuff.
Okay, so yeah, now we can go back through each one individually. I see Debbie has her hand raised.
Ms. Nadler?
Yes, thank you. So would an action for that be something like, I know San Diego County has really jumped on board this, especially with the rainbow fentanyl right now. They set up a system through their schools where they email all the parents the warnings and the dangers. Would that go under that section? The action step right there is have the schools email the parents and let them know these are the dangers. This is what's happening. We're losing kids. Be careful especially with the rainbow fentanyl.
I think
they've done a whole program based on it.
Yeah, I think probably the more broader action step would probably be an expenditure of funds to reform or update curriculums and train staff. That probably would be and to, of course, hire the different folks that would help create the new curriculums or develop this proposal even further. That would probably be to train, hire, and retain staff, or to manage staff, either or. There you go. Eric, did you have any other recommendations?
You and I were similar in similar thought trains. I think the Department of Education already has some initiatives underway in this regard. And so really, I think if we had somebody here, it's sort of elevating this as being equally important to teaching arithmetic and math and things of that sort, but making sure it's got a prominent place and support by the administration and throughout the school systems. So however we help support that, whether it's through funding or underlining this is important, probably both of the above.
Sounds good. I don't think I have any other comments, so we'll continue to the next. Debbie, did you have one last comment on this?
Yeah, I do. We had the DEA 360 here, and it's been defunded, and they did student programming, and they did poster contest, and they did everything like that, preventative, which is under that first thing, the prevention in the schools. This is hands-on with the kids using arts and communication and knowledge. It's very robust. I don't know if that's something we can specifically bring back, we can do, but it was a good program with the kids.
I would say that would probably align with the last recommendation that we did about like,
Okay.
small grant funds or
Okay.
expenditure of grant dollars. That probably would make more sense for that, but I think we already have that recommendation. So I think for
Okay.
this part, for this particular, in terms of looking at curriculums, I think probably the most sense action step would be just to give the school districts the funding they need to do to enact it.
Okay.
Yeah. I don't think I have any other comments, so well, Emma, if you can please proceed to the other one.
Okay, great. We have these listed as research and links for that recommendation. So then for this recommendation on age appropriate, innovative and or evidence-based prevention, education and programming, the subcommittee needs to determine the action step and if there's any modifications to the wording.
I would say copy and paste the action step from the other one, from the earlier one. It might probably reflect the same.
I appreciate that. Can I ask a quick clarifying question in terms
Sure.
of the recommendations, like the action steps we're able to suggest? Is it simply with respect to the settlement monies? Is that really all we have the quote power to recommend as this subcommittee?
You can also, Emma, if I'm not mistaken, I guess an action step would also be to recommend a drafting of a bill to enact
Yes.
and mandate this. Yeah.
For something within DHHS or DPVH or the Department of Education.
Yeah. I mean, because I agree, a lot of this is just the same. It's a matter of making sure we have this as a priority and then finding a way to make sure that along with that priority, it's funded as a priority.
Chair, I see Senator Severs Gansert has her hand raised.
Yeah, Senator Gansert.
Couldn't figure out where my hand was. Okay. So it's kind of interesting if you think back over the different monies that have come into the state through settlements. I mean, years ago, the tobacco settlement that actually is in statute exactly where that money goes, right? And then you've got the Bank of America settlement that came along, and that was actually distributed through the AG's office. And then there was the VW settlement, AG's office, and then you look at this, and it's going to go through DHHS. So sometimes there are opportunities where you can designate certain amounts of money into certain buckets. And I don't know that we want to do that, but that's where statute comes in. And the example, of course, would again be the tobacco settlement. And so some of it goes to the Millennium Scholarship and some goes to Health and Human Services. I can't remember which program it is off the top of my head because I'm not on the subcommittee for that. But anyway, just some thoughts.
Thank you, Senator Gansert. Eric, do you have any follow-ups or any other action steps or anything else you would like to clarify?
I don't, but I appreciate basically the previous attempts at setting up guardrails to make sure that the money was spent accountably. And I believe that would be helpful to do, but I don't even pretend to know enough, even though I've been doing this for a long time, to know how to set those guardrails up at this point in time.
Okay. Well, I think Senator Gansert and I will probably discuss further, but that's why we appreciate her institutional knowledge. Ms. Nadler.
Yep, last question. Since we were talking about, and since we're talking about prevention in school for children and protection for our youth and everything, would this be the place where you put to mandate Narcan in every single school? I just think it's so important. Can we get a bill drafted from here or make a recommendation? We're just losing too many kids.
Again, I would say that probably would fit more under the recommendation of a grant program from the last recommendation, because it looks like this one specifically is on education and programming. So, and it says, and the second part is invest in certified prevention specialists. So I think it's more so, again, looking at the curriculum versus the administration of yeah,
Sorry,
I could be wrong, but Eric.
Yeah, I'm sorry, I didn't mean to speak over you. Emma, don't we have a recommendation later on that's a harm reduction recommendation?
Yes, that's correct. We could look at placing it there as well.
Yep. Mm-hmm.
Okay, sounds good. And Senator Gansert, did you have any comments? I think I saw him.
As far as the requiring that? Is that the question? Or just
Did she cut out for anyone else? Yeah,
I'm frozen. I'm okay. I'm sorry, Senator Gansert, were you speaking
That's
to me?
okay. Can you hear? Can you hear me now?
yeah.
Yeah,
Okay. And so was the question specifically about Narcan or about 3?
Ms. Nadler was trying to figure out if it would make sense to add her suggestion on this one or on some of the other recommendations. And it sounds like it probably would make sense more on the harm reduction one and not this one. But
Yeah,
we'll-
I think the harm reduction, and then that's also sort of a one-off, right? So you doesn't necessarily have to come to this committee. Someone could respond.
yeah, I would.
Anyway,
Yeah, I would agree with you, Senator
I think it's
Gansert.
more about education.
Yeah. Okay, Emma, did you have any other?
Okay. No, I copied and pasted that down on our final list, and you can see we've laid out the justification and the research and links that were submitted to include that in the report. And then finally, this last broken out recommendation on increasing school-based mental health professionals, that also needs an action step to be determined.
I would not copy and paste the other one, but perhaps this one could be an expenditure of settlement funds to increase the hiring of mental health professionals and to support the pipeline of students in these graduate programs, or maybe to create a scholarship to help increase the pipeline. That would probably be the action step that I would recommend.
I'm so sorry, I did not catch the end. So I had expenditure of settlement funds to increase the hiring of mental health professionals. And what was the last part?
And create scholarship/fellowship opportunities for students in higher education programs, specifically looking to I think you could just end it like that. Eric, did you have a comment?
Yeah, Chair, you had mentioned strength. I don't know if you used this word, but what I pulled from it was strengthening the workforce development pipeline by creating. I don't know if you want to reference that or not. It might make it too complicated.
You can add a second bullet point.
That, or did you want
Can you
to?
add? Can you add that as a second bullet point? There you go. So you could put expenditure of funds, of settlement funds, geared towards workforce development programs.
Mhm.
All right.
There you go. Okay, any other comments or suggestions before we proceed? I don't see any, so there you go. Let's keep going.
All right, so this next one is pretty easy. This was to require the Department of Health and Human Services to allocate increased funding for the prevention coalitions, to set aside funding for small grants to programs and grassroots efforts geared towards substance use prevention and education. There were no suggested revisions at the October 3rd SURG meeting. We have the justification laid out. We don't have any research or links that were submitted. And we do need to determine the action step.
Emma, I think for this one, unless any of the committee members disagree, I think the action steps kind of ran into it. So it's just expenditure of settlement funds to increase funding for prevention coalitions to set aside funding for small grant programs. That's pretty much repeating it.
Okay. To small grant programs. Did I get that right?
Yep.
Okay.
In grassroots efforts, it's the same thing. Yeah.
Okay. All right, and then the fifth recommendation was to expand Medicaid billing opportunities for preventive services. and allow blended and braided funding to facilitate services to expand access to care for youth and adults. There were no suggested revisions. We don't have any justifications. I don't know if the subcommittee wants to kind of brainstorm a bullet now for that, as well as an action step.
So this, Senator, Chair, I'm sorry. Okay. So in a conversation with the Department of Education employee yesterday, who's helping to get they just received grant funding to provide a pilot program of expanding mental health services in 3 districts, Pyramid, Churchill, and Lyon County. She mentioned that there is, I think, provider code 60, which is to provide Medicaid reimbursement for services provided in schools. And one of the things they're working or having conversations with Medicaid on, if I have this accurate, is that they are trying to convince Medicaid to do just this with prevention code 60. In other words, kiddos who are seen within the schools would not need to have a diagnosis. They would be able to come to these professionals if they just felt like they needed social support and emotional support. So maybe one action step is to support those efforts. Again, if I have this accurately, if I'm relating it accurately, that would be to support the efforts to expand prevention type 60 to include reimbursement for preventative services and so forth.
I'm good with that. Yeah. We'll just have to double check that it's type 60, but we'll do that after the meeting. If you want to do a separate bullet point, Emma, you could probably, in addition to type 60, you perhaps could be requiring the EHHS to revise reimbursement rates in mental health and utilizing expenditure funds to match the national average.
Hey, Chair, when you say the national average, what are you referring to?
Well, it depends on what we're reimbursing for. So,
oh, I see what you mean. So
yeah.
whatever we're reimbursing for, try to peg it to the national average.
Yep. And then perhaps maybe it's not even matching the national average. Maybe it's creating new reimbursement rates that don't exist as well. So let me revise reimbursement rates. Okay, you can also, so maybe separate, I think it might be actually a third bullet point. So in the third bullet point, you can require DHHS to identify any gaps in Medicaid reimbursement for the delivery of care to support, I'm just thinking, 1 second. Trying to figure out how to say detox without saying detox, or like services like that could be a part of prevention. Eric, do you have any recommendations? Or
I don't know of a euphemism for detox. It's a pretty specific term.
yeah, require DHHS to identify any gaps in Medicaid reimbursement for the delivery of care. Just leave it as that.
Or perhaps withdrawal management.
Oh,
Yeah.
Or maybe you could, for the delivery of care to support crisis management, you could also just leave it.
yeah.
That could also
So
be.
I feel like we're starting to get a little bit into treatment when we start talking about withdrawal. So I would keep it. I don't know how much more specific you want to get with that.
I think just end it after delivery of care to support, or you can actually put just to support prevention, the delivery of care to support prevention. There you go. Looks good.
Just quick question, Chair. I'm wondering for the second bullet point, just to make it a little bit clearer, if you want to say require DHHS to revise reimbursement rates and utilize expenditure funds to match the national average reimbursement rate per service type or something like that. Or maybe just end at reimbursement rate. But when I heard you explain it, that additional explanation provided the clarity that I needed, that you're really talking about each of the different service types, making sure those national averages are met.
Yeah. I don't know if that's fine, and I would agree. I don't know if the second bullet point needs to be revised specifically to reimbursement rates that look at mental health.
Oh,
Also average reimbursement rate for services, right? Because it's for a variety of services, because you pointed out that it's not just like one service.
That's correct, Senator Gansler. Yeah. I think, yeah, I actually might look good. I think that's fine. If anyone else has any other comments or suggestions, those are 3 good action steps.
Great. And is there any justification you'd want to add to this recommendation?
well, I don't know how to do it as succinctly as what you've done so brilliantly on previous slides, but there's a body of research that indicates investing in tier 1 and tier 2 services saves so much money and provides much better outcomes than putting all of our money into the highest level tier 3 intervention services. And in fact, prevents folks from having or needing tier 3.
Debbie Nadler agrees.
Let me just copy and paste this real quick. We're almost to the end. Starting this slide. Okay. All right, so we'll go back after the meeting, as the chair indicated, to verify that it is type 60. And then for recommendation number 6, that also had 3 separate recommendations to support harm reduction. So on the following slides, I added the justification and action steps. So for 6A, that was to make a recommendation to DHHS to utilize opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada, to base this on the state naloxone saturation plan to create a stable, sustainable source of overdose reversal medication throughout the state. So I believe this is where Eric had suggested potentially could be the spot to add Debbie's recommendation on Narcan in schools. I will say in a previous meeting, it was recommended to use the term overdose reversal medication in case there are other medications that come up in the future, not to limit it to a specific brand. So I think that would be the question first is, does the subcommittee want to alter this recommendation to add anything else to it?
Yes, but this is Debbie Nadler. If this is where we can add the mandatory overdose reversal medication in all schools, K through college, however. Where this would go.
So this is, Eric, could that be part of the action steps, or does it have to be part of this language here?
I think we should keep my personal interpretations, we should keep the language as is for the recommendations and add that as the action step. There you go. So maybe a third bullet point could be expenditure of settlement funds to support the distribution of overdose reversal medications at the community level, including in schools and other
So
and other institutions.
Yeah, like libraries, other public buildings.
Yeah, other public institutions. You can just leave it as that. You don't have to specify. Yeah. Debbie?
Yes, so right now the schools are able to get it, I was told. It's the question of mandating it, making it mandatory. Can we not add that word in there for the schools? Mandatory?
Yeah. You could, I mean, can you go back to the action step, Emma? And require, here, I can help you out. You can make a third bullet point, you can, require the Nevada Department of Education to collaborate with school districts on the distribution of overdose reversal medications and other services to support harm reduction. There you go.
Well, they know that's mandated because they were pretty much all over the place when I was talking to CCSD and the Nevada State Board. I guess they want to see the word mandate because they keep telling me, well, they have it. It's their choice whether they want to use it or not.
Yeah, I think for this particular instance, I would be inquiring as to why schools don't want it. And if there's a reasoning as to why they're turning it away, then it probably makes sense for the Department of Education to create some sort of strategy on how to encourage it and how to support other mental health or harm reduction services, because it might not just be the distribution of naloxone.
Okay.
So that would be just my inclination. Otherwise, you would have to just go into the process of drafting a bill to require all of them to do it. Any other suggestions or comments? I don't see any. Emma?
All right. So then 6B was to create a recommendation to the legislature modeled on Maryland's STOP Act, which authorizes certain emergency medical services providers to dispense naloxone to individuals who receive treatment for a non-fatal drug overdose or were evaluated by a crisis evaluation team, and requires certain community services programs, certain private and public entities and hospitals to have a protocol to dispense naloxone to certain individuals free of charge under certain circumstances. And I'm just trying to, okay, so this was the justification, and the action step identified was a bill draft request based on the Maryland STOP Act. And I know, I believe Jessica Johnson was the subcommittee member who had submitted this, and she wasn't able to be here today.
I think it's good. There's another action step would be not just the bill draft request, but expenditure of funds to enact that legislation. That probably would be the other. Because it will probably be met with a fiscal note. So you want to make sure it gets passed. All right, and then finally, 6C was to promote telehealth for Matt, considering the modifications that have been made under the emergency policies. There was a suggestion in the last SURG meeting, so I'm going to go to that slide. So there was a suggestion to potentially combine this recommendation with a recommendation from the Treatment and Recovery Subcommittee, which was to expand access to MAT and recovery support for SUD, limit barriers to individuals seeking treatment regardless of the ability to pay, and encourage the use of hub and spoke systems as well as recovery support, including use and promotion of telehealth, considering the modifications that have been made under the emergency policies, and pursuing innovative programs such as establishing bridge MAT programs in emergency departments. Any comments?
Chair,
Eric?
I think that in this particular case, it makes sense to merge with this recommendation.
Sounds good. Do we have any other comments or any disagreements? Seeing none, I think we'll go ahead and merge or follow Eric's request. Okay. Emma, did you need anything else from us, or can we proceed?
Oh, I'm sorry. I think I was on mute. I apologize. What would the action step be for this?
I believe there may be actual policy changes that need to be made. I'm not sure because I'm not an expert on what the current policies are for providing MAT, but there may be policy changes that need to be made so that MAT can be delivered via telehealth. I put that as a question mark. I think we'll have to investigate that.
Okay. Anything else?
I mean, the other thing would be just the implementation of that. For instance, if you're going to pursue programs such as establishing bridge MAT programs in emergency departments, it might cost money to do that. So once again, the expenditure of settlement funds to enact these changes and recommendations, or to enact these recommendations.
So, and
Eric, yeah.
yeah, I didn't want to step on Emma's thought process.
Thanks.
Are you good for me to go, Emma?
Yes.
Okay, so in talking with a friend who runs one of the local MAT clinics here in Reno, he has expressed to me that the MAT reimbursement rate is really low. It's barely enough to cover costs. And so, you know, he's been asked many times to expand into rural Nevada, but he can't justify it because it doesn't cover the cost by the time he goes out there. So we've sort of spitballed in the past about whether or not there'd be such a way to provide like an enhancement for providing MAT in rural areas, or barring that, do we just need to look at increasing the reimbursement rate for MAT services so that more things can be done in this area?
Yeah, Eric, I would say that I think that kind of aligns with the Medicaid recommendation
yeah.
already now, so we might not have to repeat that twice.
Agreed.
Yeah.
Yeah, if we just borrowed from there and said the same thing about matching federal averages with respect MAT delivery services, yeah.
Add that as an action step. Is that what you're suggesting? Okay. I can go back. I have no idea what slide that's on, but I'll leave a note for myself to go back and do that. So add language on matching average national reimbursement rates. And so just so I understand the justification or the action step for this, is that so that Matt can continue to be delivered via telehealth once the public health emergency ends. Is that kind of what you were speaking to?
Well, if that's right now the only enabling language that allows us to do provide Matt via telehealth, then yeah, we need to find some sort of policy change that would allow for that to continue.
Okay. All right. Well, then let me just quickly copy and paste these last 3, because I don't know, Chair, if you want to do a final vote on all of them, or what the process is for that. And I just need to copy and paste this one.
I think we're good to proceed since we've already gone through most of them. So unless anyone disagrees, I think that pretty much concludes this agenda item. Or did you want me to do I need to put it up for a vote just for final approval?
I don't know. I believe we have Rosalie on the line. I don't know if we need guidance from her on whether that's needed or not.
Oh, I think I was muted there. If you just repeat the question, you're wondering, I
Yeah,
guess what,
would you like for me to call this to a final vote so that we can finally confirm and approve all the
when you
recommendations?
guys are there at the end, yeah, a vote would be necessary to make this your final recommendation. You can encompass a lot into the vote. You can say basically a vote encompassing all the changes that we've made today, discussed today, and those in favor of approving it.
Chair, would you like to entertain a motion now or later?
I'm waiting for Emma. Are you ready?
Oh, yeah, I'm ready. Sorry. So I copied and pasted all of the recommendations as changes were made. So it's just slide 29 and 30.
Sounds great. Okay, so seeing that we have reached the conclusion of going and coming through all these recommendations, I would like to go ahead and ask if there's a motion to be entertained to encompass all of these changes together and to make our final approval.
So moved for the record, Eric.
Thank you so much. We have a motion from Eric and then a second from Senator Ganser. Do we have any questions or suggestions or comments?
I just have to say, I feel really good about these. I feel like we've done, as a subcommittee, a really good job of going over these, and in this process, I think has only helped them to become better. So I think nice work, everybody.
Thank you so much. Well, Debbie, did you have something to say, or are we good to proceed to the vote?
We're good.
Okay, thank you so much. Let's go ahead and call it to vote. All those in favor, please say aye or raise your hand.
Aye.
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 Any opposed? Any abstentions? With a unanimous vote, these recommendations have been approved. Thank you so much. Let's go ahead and move on to the next agenda item. Give me 1 second just to pull everything up from my side. So we are now reaching towards the end of this meeting. I just want to reiterate that section 7E of the SURG bylaws state that the subcommittee members will serve for 1 year on the subcommittee. After 1 year, the working group chair will determine if the subcommittee needs to continue for another year. If the committee is needed for another year, the working group chair will appoint the subcommittee chair and members from the working group. In order to get a sense of who would like to remain or move to another subcommittee, we have this agenda item which is being included for all of you all to discuss. So I would like to hear if you would either like to serve and stay on the prevention subcommittee or move to another one, such as the treatment and recovery subcommittee or the response subcommittee. And then also this is the agenda item to see if there's anyone who would be interested in serving as a chair or a vice chair of the subcommittee appointment. So we'll leave it as that. Ms. Nadler, did you have a comment?
Oh, yeah, I just want to stay on the prevention subcommittee. I don't know if we're supposed to comment on that yet.
Yep, that's helpful. I think we'll notate that down. Is anyone interested in serving as the vice chair for the subcommittee? I recognize that Senator Ganser and I will probably be called into session, so I think that probably limits us.
So Chair Doniati, a real quick question before I answer that. My feeling, and I don't know if this is true because I'm still sort of gaming out what all this committee can do and the subcommittee can do. But during the legislative session, I am assuming the SURG committee is going to probably be less active, simply because we'll have made our recommendations and there will be less for us to do. Is that a correct assumption or no?
I think that's a question for Emma and the team.
I think that's right. The full SURG meeting in December, I think there's going to be an agenda item to discuss the frequency of subcommittee meetings, but I think what you've laid out, Eric, makes sense.
Because
and I see Dr. Kearns has her hand raised. She could probably add more.
Yeah, I was just going to add that one of the things that we had discussed in one of the other subcommittees is the fact that once we make our recommendations, if there is any recommendation for policy change and there ends up being a BDR that would go forward, one of the things would be to follow it. And if there's any need for any subject matter expert testimony or providing resources, those sorts of things. So while you're right, I think, Eric, the frequency wouldn't be as much, but it's really then to support. And then, you know, the feedback loop, if there's any recommendations for changes within the legislation and those sorts of things.
Okay. So thank you for that context. And sorry, Terry, did you have more to say? Your hand went back up.
No, sorry, I was trying to put it down.
Okay.
Yep.
So Chair Doniati, I would be happy to serve as vice chair.
Thank you so much. Do we have any other comments or suggestions?
A motion that we accept him.
That's great. And I think that needs a second. So Senator Ganser, if you're still on.
If I may, Chair, I believe it's the Attorney General who has to appoint the chairs and vice
gotcha.
chairs. So
Okay, we'll submit that as a recommendation.
we're just trying to get a sense of who would be interested, so that way he would be able to make those appointments.
Sounds good. I think we've got our determination. Are there any other comments for this agenda item or anything else? I don't see any. Okay, let's go ahead and close this agenda item. We'll move on to, I think Emma has everything good for sending it back to the AG's office. So we'll conclude with that. And we'll move on to public comment. So again, if there's anyone in the audience that would like to provide any public comment, this is the time to do so. Of course, you're limited at 3 minutes each, and we won't be able to take any action at this time. I see Ms. Fairchild has her hands up, so please proceed.
Thank you. Rhonda Fairchild for the record. And I just wanted to comment on 6.C when you guys were talking about telehealth for medication-assisted treatment. And I work in a medication-assisted treatment facility. And so for me, it's really important that somebody who is receiving medication-assisted treatment sees a doctor and is drug tested regularly. So even though I think telehealth is great for counseling, having that physical interaction with the doctor and drug testing, so we know that there's no illicit drug use going on while they're on medication-assisted treatment, is really important. So I would like to see something added in about, also Medicaid requires certain numbers of visits to be reimbursed for medication-assisted treatment. So I'm not sure. I think it's 2 times a month. A client has to meet with somebody for counseling. So I'd like all of that to be considered. Thank you.
Thank you so much for your comment. Do we have any other comments at this time?
Yes, Chair, just really quickly, I'm sorry, I had emailed Eric Schoen for the record, had emailed my contact at the Department of Education, and she did confirm it's type 60.
Thank you so much, sir. Is there anyone else at this time that has any other comments? public comments? I don't see any, so we'll go ahead and close this agenda item and we'll reach adjournment. So once again, thank you everyone for your work and effort, and of course to the subcommittee members and to anyone in the public who has helped us with this process, and very excited to see them reach the next step. So thank you all, and meeting's adjourned.